Conversion disorder, now formally known as Functional Neurological Symptom Disorder, FNSD, represents one of the most intriguing and complex conditions in modern medicine. This neuropsychiatric disorder challenges our understanding of the intricate relationship between mind and body, demonstrating how psychological distress can manifest as genuine physical symptoms without identifiable structural damage to the nervous system. The condition affects individuals across all demographics, cultures, and socioeconomic backgrounds, yet remains poorly understood by both healthcare professionals and the general public. The hallmark of conversion disorder lies in its presentation of neurological symptoms that cannot be explained by conventional medical testing or neurological examination. Patients may experience a wide range of manifestations, including motor symptoms such as weakness, paralysis, abnormal movements, or gait disturbances. Sensory symptoms frequently occur, encompassing numbness, tingling, vision problems, hearing loss, or pain. Some individuals develop seizure-like episodes that closely resemble epileptic seizures, but show no abnormal electrical activity on electroencephalogram testing. Speech difficulties, including mutism or altered voice patterns, may also emerge. These symptoms are not consciously produced or feigned. They represent genuine neurological dysfunction that significantly impacts the patient's quality of life and daily functioning. The etiology of conversion disorder remains multifaceted and incompletely understood. Psychological factors often play a crucial role, with many patients experiencing significant emotional trauma, chronic stress, or underlying psychiatric conditions such as anxiety, depression, or post-traumatic stress disorder. The disorder frequently emerges during periods of intense psychological conflict or following traumatic life events. However, it would be overly simplistic to attribute all cases solely to psychological causes. Emerging research suggests that conversion disorder may involve complex interactions between psychological, neurobiological, and social factors, with alterations in brain networks responsible for motor control, sensory processing, and emotional regulation. Neuroimaging studies have revealed fascinating insights into the neurobiological basis of conversion disorder. Functional magnetic resonance imaging and positron emission tomography scans have demonstrated altered activity in brain regions including the prefrontal cortex, anterior cingulate cortex, and limbic structures. These findings suggest that conversion disorder involves disrupted communication between brain areas responsible for voluntary motor control, emotional processing, and conscious awareness. The symptoms appear to result from functional rather than structural abnormalities, meaning that the brain's hardware remains intact while its software experiences significant dysfunction. Diagnosing conversion disorder presents considerable challenges for healthcare providers. The condition is diagnosed primarily through exclusion, requiring comprehensive medical evaluation to rule out organic neurological diseases. Clinicians must carefully assess the patient's symptoms, medical history, and psychosocial circumstances while remaining sensitive to the genuine nature of the patient's distress. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, has refined the diagnostic criteria to emphasize the presence of neurological symptoms that are inconsistent with known neurological or medical conditions, rather than requiring evidence of psychological factors or stressors. The diagnostic process often involves multiple medical specialties, including neurology, psychiatry, psychology, and primary care medicine. Neurological examination may reveal inconsistencies or variability in symptoms that suggest functional rather than organic etiology. For instance, weakness may demonstrate a give-way pattern during strength testing, or sensory loss may follow non-anatomical distributions. However, these findings must be interpreted carefully, as they can also occur in some organic conditions. Advanced neuroimaging, electrophysiological studies, and laboratory tests are typically normal, but their primary purpose is to exclude other medical conditions rather than confirm the diagnosis of conversion disorder. Treatment approaches for conversion disorder have evolved significantly over recent decades, moving away from purely psychoanalytic models toward more comprehensive, evidence-based interventions. The most effective treatments typically involve multidisciplinary approaches combining neurological, psychiatric, and psychological expertise. Cognitive behavioral therapy has shown particular promise, helping patients understand the relationship between thoughts, emotions, and physical symptoms while developing coping strategies and stress management techniques. Psychoeducation plays a crucial role as patients and their families benefit from understanding the nature of the disorder and its relationship to psychological factors. Physical rehabilitation represents another cornerstone of treatment, with physiotherapy and occupational therapy helping patients regain function and confidence in their abilities. These interventions focus on retraining normal movement patterns, improving strength and coordination, and addressing any secondary complications that may have developed due to prolonged immobility or altered function. Speech therapy may be necessary for patients with communication difficulties, while specialized movement disorder clinics can provide targeted interventions for those with abnormal movements or postures. Pharmacological interventions may be beneficial for some patients, particularly those with comorbid psychiatric conditions. Antidepressants, anxiolytics, and anticonvulsants have been used with varying degrees of success, though the evidence base for medication treatment remains limited. The choice of medication should be individualized based on the patient's specific symptoms, psychological profile, and medical history. It is important to note that medications alone are rarely sufficient for treating conversion disorder and should be combined with psychological and rehabilitative interventions. The prognosis for conversion disorder varies considerably depending on multiple factors including symptom duration, severity, patient age, psychological factors, and access to appropriate treatment. Some patients experience rapid improvement with appropriate intervention, while others may have a more chronic course with periods of remission and exacerbation. Early recognition and treatment generally lead to better outcomes, emphasizing the importance of healthcare provider education and awareness. Younger patients often have better prognosis, though the condition can affect individuals of all ages. Living with conversion disorder presents unique challenges for patients and their families. The invisible nature of the condition, combined with societal misconceptions about functional disorders, can lead to stigmatization and social isolation. Patients may face skepticism from healthcare providers, family members, and employers who struggle to understand how real symptoms can exist without identifiable medical cause. This lack of understanding can exacerbate psychological distress and potentially worsen symptoms, creating a vicious cycle that complicates recovery. Support systems play a vital role in recovery from conversion disorder. Family education and involvement in treatment can significantly improve outcomes by creating a supportive environment that encourages recovery while avoiding reinforcement of disability behaviors. Patient support groups, both in person and online, provide valuable opportunities for individuals to connect with others who understand their experiences and challenges. These communities offer practical advice, emotional support, and hope for recovery. Research into conversion disorder continues to advance our understanding of this complex condition. Studies investigating the neurobiological mechanisms, genetic factors, and treatment approaches are providing new insights that may lead to more effective interventions. The recognition that conversion disorder represents a genuine neurological condition rather than a purely psychiatric phenomenon has improved patient care and reduced stigma within the medical community. Prevention strategies for conversion disorder focus on early identification and treatment of psychological risk factors, stress management, and building resilience. Mental health awareness programs, trauma-informed care approaches, and improved access to psychological services may help reduce the incidence of conversion disorder. Additionally, education for healthcare providers about the nature of functional neurological disorders can improve early recognition and appropriate referral for treatment. In conclusion, conversion disorder or functional neurological symptom disorder represents a fascinating intersection of neurology, psychiatry, and psychology that challenges our understanding of mind-body relationships. While the condition remains complex and sometimes difficult to treat, advances in research, improved diagnostic approaches, and evidence-based treatments offer hope for better outcomes. Recognition of conversion disorder as a legitimate neurological condition deserving of compassionate care and appropriate treatment represents an important step forward in addressing the needs of affected individuals and their families.